Hello. First of all, I'd like to thank the ASGE and gastrointestinal endoscopy for accepting our work for publication. My name is Dr. Pradermchai Kongkam. Now I am working at Chulalongkorn University and King Chulalongkorn Memorial Hospital, Bangkok, Thailand. I would like to introduce my colleague, Dr. Kittithat, and I would like to thank all my other colleagues who has his name for doing this research and presenting our research in this GIE journal together. The title of our research today is 1-year survival rate of unresectable pancreatic cancer, size smaller than 4 cm, treated with or without EUS-RFA. As you may know, majority of patients with pancreatic cancer presented to doctors with unresectable stage. In general, survival time is not good. By average, survival time is shorter than 1 year. Currently, researchers have applied EUS-RFA as part of the treatment with concurrent chemotherapy for treating of patients with pancreatic cancer. To date, there are at least 4 studies that show the potential increased survival time of patients receiving concurrent RFA for treatment of pancreatic cancer. Our group is one of these 4 studies. Our group show benefit on local control, but we could not show benefit of survival time because majority of patients in the past study are large tumor diameter. So in this study, we are interested to focusing on pancreatic cancer tumor diameter smaller than 4 cm, and we compare between concurrent RFA versus chemotherapy alone. So now I would like to invite Dr. Kittithat to present results of our current study.
As for the methodology, we perform non-randomized control trial and we include all the pancreatic duct cancer who we deemed unresectable during 2017 to 2022. All patients were included in the analysis who have primary tumor size less than 4 cm. The patients were separated into 2 groups. The first group is the patient who received EUS-guide RFA, and the second group is the patient who didn't receive EUS-guide RFA. We performed propensity score matching analysis to adjust the baseline characteristics between these 2 groups. As you can see here, for the baseline characteristics, we include 12 patients in the EUS-guide RFA group and 35 patients in the non-EUS-guide RFA groups. As for the baseline characteristics, we adjust the baseline characteristics to be equal by using the propensity score matching analysis. As for the main result of the study, we found a significant improvement in the overall survival in the patient who received EUS-guide RFA. The 12-month overall survival rate was 58% in the patient who received EUS-guide RFA versus 22% in the patient who didn't receive EUS-guide RFA. And the median overall survival was 13.4 months in the patient who received EUS-guide RFA versus just only 7.7 months in the patient who didn't receive EUS-guide RFA. As for the progression-free survival, we found a trend toward improvement in the progression-free survival in the patient who received EUS-guide RFA. However, the difference was not statistically different.
So now you see the result of our study that with the concurrent RFA, we can increase the survival time of patients with pancreatic cancer smaller than 4 cm in diameter. However, the size of this current study is a retrospective study. So for in the future, I would suggest that we should focus on maybe randomized control trial comparing between concurrent RFA versus chemotherapy alone in patients with small primary pancreatic tumor, or we can compare combined RFA plus chemotherapy versus combined radiation with chemotherapy as a treatment for pancreatic cancer smaller than 4 cm in diameter, for example. So with that, I would like to thank you very much for your time listening to our presentation. Thank you very much.